Hey there. I am truly honored that you're considering working with me as your naturopathic physician. When it comes to your health, I understand how important it is to choose the right person to address your needs. There's so much information out there, so many different modalities of medicine, and so many different doctors to choose from. It can be a very challenging decision. But the most important thing is that you feel 100% comfortable and confident with the physician and team that you choose. And based on what you've already heard, read, or seen about us, if you're confident that we're the right office for you, then go ahead and schedule your initial consultation with us. But if you're not 100% sure, then I highly encourage you to schedule a complimentary discovery call with us. This is a brief 10 to 15 minute phone conversation that allows you to ask us questions and allows us to ask you questions to see if it's a good fit. If it is, then we can get you scheduled for your initial consultation. We are a naturopathic medical office that offers exceptional healthcare with a totally different approach. Instead of focusing on symptoms and disease, we center our approach on health and vitality. Our goal is to identify and address the underlying root cause of your health issues so we can help restore your body's natural ability to heal itself. Even if you're healthy, we look forward to assisting you in optimizing your health and well-being. We want you to live a fulfilling and extraordinary life, so we do our best to educate and empower you with the knowledge that you need to thrive. I won't go into the nitty-gritty details here, but if you would like to learn more about our methodology and approach, I invite you to watch the Fast Class video located a little further down on this page. So what does working with us generally look like? Once we get you scheduled for your initial consultation, just like every other doctor's office, we too will require you to fill out the new patient intake forms. But unlike every other doctor's office, we actually review those forms. In fact, these forms are super vital in our process because they provide us essential information to help us better understand your current level of health and your health concerns, and also allows us to start to determine the underlying cause of your health issues and dysfunctions so we can best guide you. So, to show that you are committed to your own health and to allow us to be prepared for your initial visit, we do ask that you fill out all of the intake forms on our patient portal, which usually takes about 30-45 minutes. And we request that you have these forms fully completed at least 3 to 5 business days prior to your initial consultation. If this doesn't happen, and if all of the forms aren't fully completed within 3 to 5 days of your initial consultation, we may need to cancel your appointment and reschedule it for after you've fully completed your forms. How we look at this is, if you're not willing to fill out the new patient paperwork, then you probably won't be willing to commit to some of the things that we may recommend to you to regain your health and vitality. So it just may not be a good fit at this time. But once all the forms are completed, we can go forward with the next step, which is the initial consultation. This is a comprehensive 60 to 90 minute consultation where we take a deep dive into your health issues, health history, and health goals. During this consultation, we'll go over your intake forms, discuss all of your current health concerns, take a full medical history, perform a physical exam as appropriate, and then create a comprehensive individualized treatment plan specifically for you based on all the information that we discussed. And then we have follow-up visits. The frequency of follow-up visits depends on your health concerns and what we're actually treating. But the first follow-up is usually scheduled between 1 and 3 months after your initial consultation. And then further follow-ups are every 2 to 3, 4 months after that, depending on how you're doing. As your health improves and your symptoms resolve, these follow-up visits become less frequent. And for your convenience, we do now offer follow-up visits to be done through telehealth video and/or phone consultations. So that's nice. When it comes to testing does often play a valuable role in gaining the information we need for proper diagnosis and treatment options. But just to let you know, I don't like to over-test people, which means not everybody that comes into my office gets the same testing. I will typically recommend appropriate testing if it's necessary, if it'll help us determine the underlying cause of your health issues, if it'll help us determine a diagnosis, and/or if it'll help us change the treatment strategy. And while some of these tests may be covered by insurance, others may not be covered, especially if they're more of the functional lab tests. So it's always a good idea to check with your insurance company beforehand to find out if the labs will be covered or not. If they're not covered, we do try to minimize your out-of-pocket costs as much as we possibly can by utilizing different labs that offer discounted pricing for our cash-paying patients. We understand that any little bit helps. And finally, we are a fee-for-service practice, which means that we do not bill insurance companies and patients are responsible for payment at the time of service. And we choose this structure not to be exclusive or difficult, but to be able to prioritize personalized care and provide the highest level of attention to each of our patients. This approach allows us the flexibility to focus solely on your health, without the restrictions of insurance companies telling us what we can and cannot do, what we can and cannot order, and what we can and cannot treat. It just makes for a much better healthcare strategy and ensures comprehensive and tailored healthcare and treatment plans specifically for you and your health. We currently offer a la carte pay-as-you-go payment options and/or our different comprehensive health program options. And we do typically recommend patients become a part of our comprehensive health programs because over the years we found that it just typically helps with commitment, accountability, and ultimately results. But the choice is yours. So that's it. That's our general approach and a few beliefs and values on the way. If this aligns with you and you're ready to take the next step to regain your health and vitality, go ahead and contact us to schedule your complimentary discovery call or your initial consultation. We look forward to working with you.